JD sits at the edge of his bed, rubbing his jaw with an annoyed half smile. It's nothing. Just a little toothache. It will go away. That's what he tells himself as he pops a painkiller, tosses the empty blister pack onto the dresser, and heads off to work. Days turn to weeks, then months. Life doesn't slow down for dental pain. Work deadlines pile up like sandbags. His kids want help with school projects. His parents need rides. His inbox grows faster than he can clear it. And in the background, like a ticking bomb, there's that dull, nagging ache deep in his lower right molar. Sometimes it pulses. Sometimes it throbs. Sometimes it disappears completely, tricking him into thinking the problem solved itself. By the time 3 months pass, JD is used to it. He thinks he's fine. But he's not. And what he doesn't know yet is this: that tiny ache in his tooth, that small, ignored, insignificant pain, is already part of a story spiraling toward the unthinkable. But what JD will soon learn is that the ache in his tooth is only the beginning of a journey that will take him and us to the very edge of survival. Inside the most delicate, protected, and mysterious organ of the human body, the brain. A neglected molar, a hidden bacterial invasion, a race against time. This is the medical mystery most people never see coming, until it's too late. Goody jolts awake, gripping the sides of his head. A splitting, violent headache pounds behind his right eye, the same side as the tooth. He squeezes his temples, misdiagnosing himself. Maybe it's stress. Maybe it's dehydration. Maybe I'm sleeping wrong. But every day, like a cruel metronome, the headaches return. And each one lines up perfectly. Same side as the tooth. Same nerve pathway. Same relentless building pressure. Then come the mornings where he can barely stand. Where the room spins. Where the pain blinds him with white flashes. His wife puts her foot down. You're going to the doctor, now. Bright hospital lights, a curtain sliding closed. Routine questions. How long has the headache been going on? Which part of your head hurts? Any fever? Neck stiffness? Vision changes? JD answers everything honestly, except one thing. When they ask if he has any dental issues, he shrugs. Just a toothache, nothing serious. The ER team orders a CT scan. It comes back clean. JD is discharged with migraine medication and a follow-up recommendation. But something inside his head, something none of them can see yet, is already growing. Over the next few days, the headaches worsen. Painkillers stop helping. JD lies awake at night, sweating, clutching his skull. His wife notices he's becoming forgetful. He slurs words occasionally. His balance seems slightly off. This time, they go back to the hospital, and the doctor decides to go deeper. We're ordering an MRI. The MRI lights up like a storm. A white glowing mass presses against the right side of JD's brain. Not a tumor. Not a hemorrhage. Something else. Something far rarer and more dangerous. A brain abscess. A collection of pus. A pocket of bacteria thriving inside the brain, pushing against tissue that can't move, can't escape, can't expand. The neurosurgeon delivers the news calmly. But JD's wife hears the urgency beneath every word. We need to operate tonight. They wheel JD to the operating room. His head is shaved. IV antibiotics rush into his veins. Machines beep steadily as masked surgeons prep the drill. A tiny hole is opened in his skull. A catheter slides in, and then, under pressure, thick yellow-green pus drains out. The operating room falls silent. This infection has been growing for weeks, maybe months, and the culture samples they take will reveal something astonishing. The bacteria originally came from JD's mouth. A simple, neglected toothache allowed bacteria to slip past weakened enamel, down into the root, into the bloodstream, and all the way into his brain. JD never imagined a dental problem could become a neurological emergency. But it has. Your mouth is not isolated. Every tooth contains blood vessels, tiny superhighways with direct access to your heart, your lungs, and your brain. Think of it like this. Your bloodstream is a massive river system. Your mouth is a busy harbor. If that harbor gets infected, the entire river system is at risk. In most people, the immune system stops the invaders. But sometimes, when the infection grows deep, bacteria breach the barrier, slip into circulation, and ride the currents to their final target. The brain is protected by a fortress called the blood-brain barrier, but once bacteria break through, they multiply. They form pus. Pressure rises. The brain swells. And because the brain is trapped inside a rigid skull, swelling becomes deadly. Untreated, a brain abscess is fatal. Even treated, it's a medical emergency with lifelong consequences. JD's case isn't unique. Every year, thousands of people end up hospitalized because they ignored a toothache. The infections don't always stay in the mouth. Some spread to the heart, causing endocarditis. Some spread to the lungs, causing pneumonia. Some spread to the jaw, causing bone infections. And in the rarest, most terrifying cases, they spread to the brain. A toothache isn't a minor inconvenience. It's an alarm, a signal, a message. Ignoring it is like ignoring smoke in your house, assuming it will go away while the fire keeps growing. 7 days after his surgery, JD suddenly can't move his left hand. Then his speech slurs, his face droops, alarms ring, nurses rush in, doctors press on his limbs, checking strength. He's having a stroke. The inflammation from the abscess has constricted arteries, interrupting blood flow. Even with surgery, even with antibiotics, complications like this happen. Because the brain doesn't forgive easily. JD's world tilts sideways. He can't walk without help. He struggles to lift a spoon. He forgets words mid-sentence. This is the price of ignoring a toothache. Not because he was careless, but because life gets busy, and pain becomes background noise. The ICU becomes home. JD's wife keeps notebooks filled with daily updates, medication schedules, and questions for doctors. She researches relentlessly, determined to help others avoid their mistake. His parents sit beside him, holding his hand during therapy. His children make drawings. "Get well soon, Dad. You're strong." Nurses encourage him. Rehab therapists push him. Neurosurgeons check in at all hours. JD is not alone. And through the struggle, a message begins to form. One his doctors agree must be shared. A toothache is not just a toothache. After nearly a month in the hospital, JD finally gets the infected tooth removed. To keep his mouth clean, he starts rinsing with hydrogen peroxide. Too much, too strong, too often. Then he switches to high-strength Listerine. Again, too much. The result? He kills not just the bad bacteria, but all the good bacteria. The new invader takes advantage. Fungus. His tongue develops a dark coating, a condition called black hairy tongue. It's harmless but disturbing. Another battle in this long war. Each day becomes a reminder. Healing isn't only physical, it's emotional, it's mental, it's humbling. Medical studies now show gum disease can raise the risk of heart attacks. Chronic oral infections may increase dementia risk. Some researchers find links between gum bacteria and Alzheimer's disease. Poor dental hygiene increases inflammation throughout the body. In other words, your mouth is the gateway to your entire system. When it's healthy, your body fights better. When it's infected, the consequences reach places you'd never expect. JD eventually walks again, slowly, carefully, deliberately. His speech improves. His balance stabilizes. His energy returns little by little. But the scars remain. Physical scars, emotional scars, and a deeper understanding of how fragile health can be. His story is not a horror tale. It's a warning, and it's hope. Because what happened to JD can be prevented in millions of people, with simple attention, early action, and respect for the signals our bodies send. If you have a toothache, don't wait, don't guess, don't hope it goes away. See your dentist. Tell your loved ones to get checkups. Take care of your oral hygiene. Brushing, flossing, regular cleanings. One small action can prevent the unimaginable. Your mouth is connected to your brain, to your heart, to your life. Protect it